Hello, Danbury High School. We are pharmacy graduate students from Western New England University here to talk about the importance of over-the-counter awareness and precautions. We would like to start by thanking you all for allowing us to virtually meet with you today. The topic of discussion for today will be with regards to over-the-counter medications or those that can be taken without a prescription or doctor's approval. These medications include Tylenol, allergy medication, and cough syrup. Today, we will be focusing on the commonly used over-the-counter products such as Tylenol, aleve, and advil.
So both aleve, also known as naproxen, and advil, also known as ibuprofen, are considered non-steroidal anti-inflammatory drugs, also known as NSAIDs. This specific drug class reduces pain, decreases fever, and in higher doses decreases inflammation. Some common uses for this class are headaches, menstrual cramps, and reducing pain from a sprain or injury. It is important to recognize that these two drugs are within the same class, but can have very different side effects. The adult dosing for these drugs are as followed.
Aleve, also known as naproxen, is one 220 milligram tablet every 12 hours with a maximum dose of 3 tablets in one day. This dosing is based on the over-the-counter tablet and is equivalent to 1 to 2 tablets every 12 hours as needed, keeping in mind the maximum is 3 tablets. A precaution to be mindful of while taking these drugs is to be aware of any allergic reactions that one may experience as they take these drugs. Some signs of allergic symptoms are skin rashes, dizziness, wheezing, difficulty breathing. It is also important to consider other medications you are taking, including other over-the-counter medications. Many combination products will have similar medications in them and shouldn't be taken together. Aleve and Advil, for example.
Advil, also known as ibuprofen, another brand name for it is Motrin. You take one 200 milligram tablet every 6 hours, but if the pain or fever doesn't go down, you can take 2. Don't take more than 6 over the counter per day. Advil, 200 milligram without talking to your doctor. Your doctor may recommend higher doses, but this is not over the counter and should only be done with the doctor. If you take too much Advil or ibuprofen, it can cause stomach or kidney issues.
Lastly, Tylenol, also called acetaminophen. Tylenol is not considered a non-steroidal anti-inflammatory. Tylenol, like the NSAIDs, is an analgesic. This means it decreases pain, but it can also help lower fevers. It does not have specific interactions with blood pressure medications like the NSAID class does. The dosing for Tylenol is 2 500 milligram tablets every 6 hours as needed for those over 12 years of age. Tylenol has a maximum dose, equivalent to about 6 tablets of the extra strength tablets. Taking too much acetaminophen can lead to liver damage. Acetaminophen is a common ingredient in many cough and cold medications, so be careful using it with other medications. The total amount of acetaminophen can add up quickly if taken with other products.
To conclude, it is important to be mindful of how often you are taking these medications and what strength you are taking. Pay attention to the box and directions before starting. The back of the box will give you recommendations for how much to take, whether they should be taking with food, the reason for taking the medications, and what people should avoid the medication. There is also an expiration date on the bottle, so pay attention and don't take expired medications. Do not take more than the recommended dose on the box. And if you aren't sure, ask a parent or guardian or the pharmacist at your local pharmacy.
A study done in 2002 via telephone surveys proved exactly how important it is to be educated on this information. It was reported that 19% of participants admitted using more than the recommended dose and 24% using multiple NSAIDs together, which can lead to increased risk for toxicity. With that being said, we hope you have learned something practical today, and thank you. Use these practices to better your overall health. Thank you.